Unfortunately, we don't live in a perfect world. Even with an optimal diet, it can be hard to meet our nutrient needs in all cases. And there are several reasons for this, including nutrient depletion in soils. Over the past several decades, there's been a decline in the level of certain nutrients in soils. Therefore, the foods that we're eating that are grown in those soils don't have the same levels of nutrients that they did for maybe our parents or grandparents. There have been changes to our gut microbiome due to antibiotic use and poor diet and a number of other factors. And our gut microbiome affects how much of nutrients we extract from food. There's been an increase in the prevalence of many chronic diseases, like Dr. Heck mentioned, an 8-fold increase in diabetes in the last several decades. Many of these chronic diseases do affect nutrient absorption, or at least demand. There's been an increase in exposure to environmental toxins, which can interfere with nutrient absorption. And then there's been an increase in the prevalence of food allergies, which lead to a more restricted diet and a lower nutrient intake. So this is why I do think that most people may need some ongoing supplementation with at least some nutrients. But the question, of course, is which ones? This is unfortunately a very difficult question to answer in a general sense, because the answer depends on so many different factors. An individual's diet, their gut health, their genetics, their gene expression or epigenetics, their health status, geography, season, etc.